tongue, cheek, throat, lungs, wherever the smoke goes, and also the foot bag. Apart from that, there are only suggestions, but this is for sure. Any patient with this cancer, you ask them, they are using the tobacco in some form. So some people may say, sir, beedi pidikradilla sir, pipe da pidikra, cigarette pidikra, filter use panna. All tobaccos in any form is dangerous. And pogaila, chewing tobacco. Tobacco in any form is not acceptable for cancer. Alcohol generally does not cause cancer, but it can form a liver cirrhosis and it can produce liver cancer, indirect. But tobacco has got a direct impact on causing cancer. These are the only two known causes. All other things, somebody says environmental factors, somebody thinks dust, house dust, road dust. See, it's all not known. It's all okay, connected. Shanta will say about breast, that's good knowledge, ellame connected. But most of the time it looks as though it is gene problem. Something is coming from somewhere, from grandfather, grandmother, great-grandfather, something is coming. This is accepted. All cancers have a genetic makeup for cancer. But you can't do anything about it. It is your unfortunate thing inherited from your forefathers. So this is what happens. Ultimately, the patient is crying because the relative is gone. The doctor is like this because he is not successful in treating this patient. So the only way it comes is prevention. Can you prevent this cancer? Even then it is not a good answer. Here you see the police is just standing and trying to prevent, but they are enjoying their life. But you don't know. They are just smiling. We also smile when thinking that we are preventing, but we are not able to prevent. So some cancers, of course, can be prevented to a reasonable extent, because tobacco smoking causes lung cancer, but there are ladies who don't smoke tobacco, they get lung cancer. So they ask us, sir, na cigarette pidikradilla sir, na padaya cancer. Again the answer is, you can't say anything. Every time you say, this is what happens. Alcohol usage you have to avoid. And there is a vaccine for uterus cervix, that is Garbhapayoda Vai, that is related to viral infection. And the viral infection is the vaccine. That is the only curable, preventable vaccine. And to a certain extent, stomach cancer, H. pylori infection, and you can even diagnose by breath. Other than that, you give medicines, to a certain extent it will prevent. But of the four, the vaccine for the uterine cervix is only reliable vaccination, only reliable prevention. So, tobacco should be avoided to prevent all this. The first four definitely related. Kidney, pancreas, urinary bladder, supposed to be connected. It is not 100% sure. So, for all this, what do we do? The only solution is early detection. So ultimately we have found that nothing is possible, at least we detect it early. How to detect this early? So these are the warning signals, signs of cancer you have to be ready with. Then patients will get ready. They will go to the doctor and diagnose it early. The one thing with cancer is, it gives you a lot of time to diagnose. Nothing is instant. It does not happen in one day. Today something starts in the breast, it is said it takes 5 years for 2 centimeters tumor to be filled. 1 centimeter. Suppose 1 centimeter tumor, it has been there for 5 years. So if you have done a mammogram in between, you would have picked it up. So it gives you time. Okay, come on. This is how the war Adi, that's how it stops. Then from the breast it goes to the armpit. Stops there. That is a station. It stops there. Again, another 3-6 months later goes to the next part. Stops there. So everywhere it gives you time. So only thing is we are not utilizing that time. That is the unfortunate thing. We don't utilize. We just, and even patients don't recognize it. One lady comes and says, Doctor, this even today, they, in spite of all this public education, I am not doing the only public education program. So many public education programs are happening. All the Tamil magazines, English magazines are giving, all the ladies magazines, women's magazines are also showing this. In spite of that, people say, and they end up in big trouble. So these 7 signs, I give you the pamphlet, you don't have to write it, I'll give you that. So these things have to be remembered so that you recognize it early. Second thing is you must insist on periodical master health check. Especially when I say it is, this checking up has to be done for people more than 50 years of age. Generally, cancer is a disease of older age. Young age is rare. Like Yashoda will say some small, but it's not very, very common. But it's happening in other direction. But generally, we need not worry much about it. So, if master health checkup has to be. My impression, my suggestion is over 50 people, whether you have parents, grandparents at home, you all look young. It's not for you. When it is going above 50, get it once in 2 years. After 60, get it once a year. This once a year formula. If you get the master health checkup is valid for 6 months, roughly. The next scan, will show you what happened in the previous 6 months. So at least 6 months time you will catch something. So better you do this master health checkups every year. And if there is a strong family history, then you have to do it a different way, a little more than frequently. So either a master health checkup the complete blood count, simple blood count will catch blood cancer. X-ray test will catch lung cancer. Ultrasound abdomen will catch abdominal organ cancer, or solid organ cancer like kidney, liver, gallbladder, spleen, uterus, ovaries, all that in ultrasound. And there are some tumor markers which indicate the CEA is carcinoembryonic antigen, which is connected to large intestine cancer. Prostate specific antigen or PSA is connected to prostate cancer, and CA125 to ovary cancer. These things should be added. Blood sugar master checkup that means nothing. That's a real meaningless program. These things have to be there in any master checkup. Apart from that, you do vitamin D3, vitamin B12, all that is okay. Nothing is going to eat away your health. So cancer can be suspected by the patient themselves. Suppose, what are the cancers they can diagnose themselves? Suspect oral cavity cancers, so many things they can, something different. Skin cancer, they can see. Rectal cancer, motion blood. Stomach cancer, blood. Urinary cancer, urinary blood. Throat and lung cancers, the cellular. So these are all the things patient themselves can quickly go to the patient, to the doctor. Once you go to the doctor, most of the cancers are diagnosed by doctors, suspected by doctors. Because doctors are in the field. Then doctors only suspect. This has to be further strengthened by investigations. In investigations, again they do a blood cancer, blood count for blood cancer, X-ray test for lung cancer, X-ray bones for bone cancer, you use ultrasound abdomen for all solid cancers, CT, MRI, PET scan for the tumor spread. This only spread not for diagnosis. And the endoscopy is done for stomach and colon cancer. There is the only way you can reach the stomach and colon. So they are all only suspicion. Again, let me tell you, the confirmation is biopsy. Without biopsy, nothing can be confirmed. So if you detect early, you can treat better. I don't say that you can give a cure, you can treat better. Cure is only incident. You know, into the patient, sir, cure cure வார்த்தை நீ உபயோகிக்க மாட்டேன் 10 வருஷம் கழிச்சு நான் சொல்லுவோம் 2010 யூஸ் எடுத்து பண்ணோம் ட்ரீட்மெண்ட் ஆரம்பிச்சோம் இன்னி வரையும் நல்லா இருக்குங்க நான் க்யூர் பண்ணிட்டேன் இட்ஸ் a statement of retrospective analysis. இன்னைக்கு பண்ணிட்டேன் சரியா போய்ட்டு சொல்ல முடியாது. I have seen patients who I thought I would cure, they have come back. சில பேர் வந்து நான் இருக்க மாட்டாங்க இந்த பேஷண்ட் நினைச்ச பேஷண்ட் நிறைய நாள் இருந்தாங்க. It is such an unpredictable disease also. இது எப்படி போகும் தெரியாது, ஜாஸ்தி ஆகுமா கம்மி ஆகுமா சாகடிக்குமா அடிக்காத ஒன்றுமே தெரியாது. ஸோ வித் திஸ் That is why we have taken this public education, because this is not a simple disease. It is a dangerous disease. Be alert, catch them early, and that is why we made a public education now, so that you will give the information to somebody else, or other your friends or relatives, so that you keep educating the public. So if you work together, I think together we can do something from you and us. It is not the only doctors can do this. It's not that the patients have to cooperate. They have to learn science. Everybody has to learn some science to understand cancer. To do that, this figure can be seen. The doctor is happy, the family is happy. So because of this is only a last slide. There are so many cancer awareness days and months in the calendar. There are 18 in the world. It's not just only one cancer day. There are so many related cancer-related days are done, are observed, because if you see melanoma cancer research month, then the gynecological cancer awareness month. There are so many things are there. So everywhere people are giving information to the public so that cancer can one day may be eradicated, may be cured. This is all the combined effort. Thank you very much for your patience.